Thank you very much for asking me. So the Icelandic well-being saga, we Icelanders like to tell tales, especially about our own greatness, be it in recent times or further back. So what I wanted to talk to you about today is sort of how the Icelandic system as a whole is taking on this quest for increased child and adolescent well-being. Now, just to tell you a little bit about myself, I'm the head of Faculty of Health Promotion, Sports and Leisure at the University of Iceland. I'm also a principal investigator for the HBSC study in Iceland, Health and Behavior of School-Aged Children. I hope some of you know something about that. And I'm also a principal investigator for ESPAD, the European School Survey Project on Alcohol and Other Drugs. And as Trista said, I'm the scientific director of the Icelandic Youth Survey, which we've launched recently. So what I wanted to mention was changes in health and well-being in Icelandic youth, new challenges, changes in legislation to actually meet these challenges, and how this whole process can be supported by research. Just a little bit about these international studies. These are the biggest studies of their kind on these topics. The European School Survey Project on Alcohol and Other Drugs has been running since 1995. I can't believe how long we've kept this going. And it goes every 4 years, and Iceland has been a part of it from the beginning. And this is a questionnaire that is put forth in the 10th grade. And in Iceland, we have around 4,000 participants, which is basically the 10th grade in Iceland. You have to remember, we are only roughly 300,000 people. So the second study is the health and behavior of school-aged children, the HBSC. That actually started in 1983, but Iceland first participated in 2006. And these are all children in grades 6, 8, and 10, and around 12,000 participants usually submit data. Now, the problem is, for me, is not where to start. It's much rather where to stop, because I only have 15 minutes and I've been in this business for 30 years. So there's a lot on my mind, but I'm trying to sort of not overwhelm you with all sorts of data, but give you the broader picture. So what have we seen? We have, of course, in recent years, the high prevalence of social media use and gaming. That is particularly high in Iceland. Cigarette smoking is nearly non-existing. There are increased number of children who report having low mood or anxiety, a significant portion of lonely children as well, which we know from studies have a very big effect on their current and future health. Sexual abuse is still a big problem, and we have, of course, very many happy news as well. Icelandic parents communicate exceptionally well with their children, etc., etc. So in conclusion, there are some problems that have nearly been solved, only to have new ones emerge, but such is life, isn't it? So I want to tell you a little bit about sort of perhaps the big news from Iceland, which I'm sure many of you have heard about, and that is the decline in adolescent drinking. And here you have a graph showing adolescent drinking of children in the 10th grade, and I was assured that you had brushed upon your Icelandic so you could read this from the slide. If not, then the blue line means that these are children who have never tried alcohol. The red line, never tried cannabis. Now, as you see, from 1995 to 2015, these numbers, especially with the regards to the alcohol consumption, rose from 20% of children never having tried alcohol to 66%, and it's still rising. And then we have been asked the question, well, I mean, alcohol is a passé drug for children. They've all gone on to smoke cannabis. And as you see, that is not the case. I mean, for these 20 years that we looked upon, cannabis consumption roughly stayed the same. So here you have, if you want to take a closer look at this article details, you can look it up. But I also wanted to see whether this was more just a decline in children trying alcohol, whereas you would have the big consumers still doing their thing. And that was not so. And as you see, these are children in the 10th grade who've tried alcohol 40 times or more. You see a sharp decline there from 14% in 1995 to around or below 2% some 15, 20 years later. But there you have an interesting figure as well, where you have the cannabis line, and it sort of goes almost undetected, doesn't it? I mean, there's a slow rise, but you really need to see it in a long-term relationship to actually figure it out. But there we have actually a threefold increase in heavy use of cannabis. So going from circa 0.7% up to 2.3% in 20 years. And this sort of highlights for me very much the pros and cons of our approaches. All in all, we've been tremendously successful. I mean, there's no doubt about it, but there is still there are still groups of teenagers who are not reaping the rewards of our policies. So happily, the government wrote the Act on Integration of Service in the interest of children's prosperity in June of 2021, and it has just recently been implemented. And the whole process, of course, is a long and arduous one, and will probably take around 3 to 5 years. So, and that aligns also with the government's policy on education, where you will find things like integrated and stepwise services, meaning that the level of need will be estimated and the response will be tailored accordingly. Education and well-being is the focus of both the Act on Children's Prosperity, but also in the education policy. Early intervention. I mean, that I think that is sort of the most important part of this, is that we go in early and we go with a coordinated effort. Close cross-disciplinary cooperation, emphasis on children with immigrant backgrounds, more fully qualified teachers and professionals working with children, and these skills: reading, critical thinking, creativity, and understanding. As I said, it's a leveled, stepwise approach, and I asked my colleagues from Iceland to forgive me because I've stolen some of their slides and marked them off as my own, but I couldn't actually put them into my lecture without them being marked with the university logo. So I apologize profusely. Now, 3 levels: primary level, secondary level, and the tertiary level. Then we are looking at basic services and early assistance in the beginning, more targeted assistance and resources, and more specialized assistance. And these are all going to be sort of managed and have a responsible caseworker for each case, sort of drawing in all the relevant parties. And this is sort of my favorite picture. This, what it shows is that we're including the caseworker working with a child, is looking at it and compiling data and using resources from a number of places. And for me, I mean, obviously we have the health system, we have teachers and school, but we also have sports club. We also have leisure centers and so forth, which I think are very important. So the responsibility of the service providers, which is written in the law, is to notice and analyze indications that child needs are not being met. And unfortunately, this tends to be sort of the main emphasis of many of the organizations and structures that we've had in the past. But now we're looking more into the second step, is to respond to indication that the child needs is not being met, give guidance on how to integrate the service that as it is needed. And of course, all this is going to be worked in close cooperation with the family. Now, this new Icelandic youth survey that we are starting is focusing on almost all of childhood 10 to 24 years old. And we are yearly providing information on education, well-being, support, and the activity of these youngsters. The goal of the Icelandic Youth Survey is to guarantee schools, youth workers, government, municipalities, researchers, and the public open and free access to data, which is very, very important. And to have reliable and updated information in the so-called dashboards of children's prosperity. I don't know if you know these or have them in your countries, but in Iceland they are all the rage now. These are sorts of websites that the government or the municipalities put up, and there you can go in, everybody can go in, and you can sort of see the status of various things as they relate to children and child protection. To enable comparison with other countries, which is very, very important for us, we sort of group together, often with the Nordic countries, to engage policymakers and specialists working in the field, so we get feedback. What is it that the policymakers are interested in? What are the specialists working in the fields picking up? To cooperate with a study group on positive mental health among Nordic adolescents. And then we have these new topics, of course. In Iceland, we've reduced secondary schooling from 3 to 4 years, and there's a lot of debate going on whether how that would or would not affect adolescents. And of course, our favorite subject of all subjects, the long-term and the short-term effect of COVID. Now, this is sort of the quantitative approach to this issue. But there is also other ways of studying this. And one of the things that I'm involved is to actually study the effectiveness of the implementation of the new law. So we are going to be doing both quantitative and qualitative studies, looking at people who are working in the field and see how their sort of experience of this whole process is going to be, and how well integrated this new legislation will be. But this is still in early stages, and I cannot tell you much about it. But we also have my favorite studies, which is the intervention studies, actually going in, trying something new, and looking at it, seeing how it works, and sort of doing it on the floor. And here I would like to tell you, just remind you, or not remind you, just tell you shortly about a new study that I'm working with in partnership with Dr. Hermundur Sigmundsson in Westman Islands, which is the most southern point of Iceland, an isolated island with a few thousand inhabitants. And they've been very, very interested in increasing grit and resilience in their elementary school children, and they've been very interested in having, trying to implement a positive mindset and use physical exercise more in daily teaching. So, and we've just started this project now last autumn, and it's a 10-year project where we are going to be looking at children starting in grade 1 this fall and following them up all the way to grade 10, and see if we could sort of change their attitudes and their function and their well-being. But there's also, and I've been involved in studying group work for vulnerable adolescents in the city of Reykjavik, which is sort of a grassroots project that they started. And I have to say, I worked in Big Pharma for a number of years, and was promoting all sorts of drugs. And I have to say that the results of these group works, if we had similar results, similar decrease in or similar increase in well-being, we would have sold a lot more of drugs, I can tell you that. It's unbelievable how these sort of unstructured or semi-unstructured groups work within the field of leisure. So that concludes my slides.